Welcome to Healthcare Entrepreneur Academy, where we seek to educate, motivate, and inspire professionals into starting their own healthcare businesses. Learn from leading healthcare entrepreneurs and other business experts as they share their journey and provide a glimpse into their playbooks for success. Loaded with valuable insights and actionable strategies, this show will guide you on your path to freedom. Now, please welcome your host, entrepreneur, healthcare practitioner, and MBA, Jason Duprat.
This episode is sponsored by my free presentation for the Ketamine Academy. If you're tired of long hours, constantly being on call, or having to give up your nights, weekends, and holidays, all for an employer that only thinks of you as a productivity number that they're trying to maximize, then it's time to break free from the hospital grind, become your own boss, and finally take control of your professional trajectory. It's time you start your own practice. I know it sounds really scary, maybe even a little impossible. I get it. You got student loans, you're working tons of hours, and you may not even be a physician. Well, I am here to tell you that it's absolutely possible. Starting my own clinic was exactly how I started my healthcare entrepreneur career, and there's one specific type of clinic that almost anybody can open. Ketamine therapy is one of the most promising treatments in the fight against depression, PTSD, and chronic pain that we've ever seen. And thousands of patients across the country are looking for clinics in their area. The problem is that there aren't enough yet, and these patients need someone like you to open a ketamine practice in your hometown. Go to ketamineacademy.com/presentation for a no-cost 60-minute training on how to gain more freedom by opening up your own clinic. On the presentation, you'll discover why opening your own private clinic is a better decision than working more overtime or going back to school for another degree, why this one specific niche clinic is the easiest to open and doesn't require a bunch of cash to start, and how anyone can open this type of clinic, even if you're not a physician, by just following a few simple steps. So to register for this free training, just go to ketamineacademy.com/presentation. First, I want to give a little shout out to Francis on our team for covering for me for the last Tactical Tuesday as I got rapidly prepared to go on a deployment. Super appreciate that, Francis. You may be hearing some more episodes from him depending on what our work schedule is here. We have a lot of hours that are being assigned to us, and so in the event that I can't get a Tactical Tuesday out, then Francis is going to fill in and provide some awesome, amazing marketing advice for you guys. And so you may be hearing him on some of these Tactical Tuesdays. And again, Francis, wanted to give you a high five for knocking out last week's Tactical Tuesday and sharing some marketing advice on that one as well. Hey, what's going on? And welcome back to the Healthcare Entrepreneur Academy podcast. I'm your host, Jason Duprat, and we are back here for another Tactical Tuesday episode. And on these episodes, it is me, you, and the mic, and we're sharing a little bit about what's going on in our business, things that we're learning, things that are impacting our business, and we're sharing some tactical takeaways for you to listen to and implement in your business if appropriate, and hopefully help you shortcut your path to success. And on this episode, I want to talk a little bit about the compatibility of being a business owner and a military reservist. And then I want to talk a little bit about what it's like up here in New York City, which is where I'm deployed with the COVID-19 Navy Medical Support Team. So as it relates to being a military reservist, and this applies to all branches, reservist or guard, the obligations are very similar, and the structure of the contracts are very similar. But as it relates to being a business owner and an entrepreneur, my biggest piece of advice would be to remove yourself from your business as much as possible. Structure your business in a way in which your day-to-day duties are not vital to the success and ongoing functionality of your business. Because at any given moment, as a reservist, what we've been experiencing this last couple weeks, or this last week, is that you are on demand, on call, 365 days a year to be sent anywhere at any time in the world for any reason. And if you're in the military or considering joining the military, that's super important to keep in the back of your mind, because you don't want to have a business that is going to fall apart if you can't be there for either temporarily or any extended period of time. It's super important to think about that ahead of time. And if you have that type of business model, like maybe you're a surgeon, an independent surgeon, or maybe you own a small practice and you're the only provider, then you really should come up with some either alternative revenue sources. So that way your business doesn't collapse if you have to leave, if you have to step back for any given period of time. And you should also consider bringing in other employees or contractors that can help fulfill your role. So either other partners or other providers to help your business stay afloat in the event that you couldn't be there. And that's, for like a deployment. If you get shipped off somewhere, are you going to have to are you going to have to lay off all your employees or go out of business during a deployment? I hope not, because there are things that you can do to structure your business and to prepare for such events. A lot of people haven't, or they didn't do it. They didn't take it seriously enough. And these are sort of unprecedented times because typically you get more of a notice. From what I've heard, I've been in the military for 9 years, and it's very, very, very rare to have 12 to 48 hours notice to deploy. Typically, you can get 30 days at least to sort of get things in order, but unprecedented times call for unprecedented actions, and that's what we've seen here. And so some of these providers that are here on this military mission in New York City are very worried because they have practices that depend on them, and their practices may or may not survive this event. It's unfortunate, but it's the case for a lot of these providers where they generate almost all the income for their practice, and that's super important. And even if you're not in the military, that's something that you want to think about, is removing yourself as much as possible from the business, from the income generating aspects of the business, so that in the event of an emergency, a family emergency, a health problem, that your business can still function for some period of time without you or with minimal involvement from you, because you don't ever know what life is going to bring. And so it's super important to always be prepared for these things, military or not military. And some of the best things you can do is have a very, very hefty emergency fund. That's super important. You want to have many months. Most experts recommend 3 to 6 months of emergency funds to cover. You should be able to cover all of your employees' salaries, all of your business expenses for 3 to 6 months in a reserve account. And if you're the primary income generator for your business, you should have even more than that, because you just never know what life is going to throw at you. And if you're in the military, you could literally get deployed for 9 months, a year, 2 years. You have no idea. So it's very important to have lots of backup plans in place if you are an entrepreneur and in the military, or just an entrepreneur or an entrepreneur in general. Every entrepreneur should be prepared for different types of emergencies. So unfortunately, during this time period of COVID, we're going to see a lot of businesses go under because they didn't have any sort of foresight into what they should have been doing to prepare for things. And it's unfortunate, but it's going to happen. Next, I wanted to share a little bit about what is going on here in New York City. So essentially, so it was April 7th in the morning, got notified, shipped out Wednesday, April 8th at 2 p.m., flew into Philadelphia and got on a bus, was driven to Fort Dix. And from Fort Dix, we spent a night until we had enough healthcare providers to fill a bus and then come to New York City. So we've been in New York City since Thursday, April 9th, and now it is Thursday, April 16th. And in that time, we have done a lot of hurry up and wait, which is very typical. The bureaucracy of the military can be one of the most frustrating things. There's a lot of hurry up. We gotta go. And then you sit around and you wait for leadership to come up with a plan. That's just what happens in the military over and over again. And so we spent a couple days in a holding pattern until we figured out exactly which hospital we were going to go to. They had the Javits Center already up and operational. Initially, they were accepting only non-COVID patients, but they weren't getting much traffic because, again, the bureaucracy of trying to transfer patients over there or have ambulances drop patients off directly, that became problematic. So same thing with the USS Comfort. And so they started taking non-COVID patients, and they're trying to remove the layers of the steps and bureaucratic stuff in order to make it easier for them to see patients. Now the ship is seeing many patients, and the Javits Center is filling up. And so they had more and more providers coming in from around the country, and they weren't really sure exactly where to put them. So they came up with an idea to have community teams. So that's where I'm assigned. I'm on a community team. We're staffing a hospital in North Central Bronx. And with that team came two handfuls of providers and a bunch of nurses. And we are there working in their ICUs and helping them however we can. Fortunately, just as we were getting here, the New York City, the number of cases and the death tolls had started to plateau. And so we came at a time when things are starting to level off. It's good and bad. Would have been great to have been here a few weeks earlier, but all the social distancing and isolation did a great job of curbing this infection, and so things are plateauing, and hopefully they'll be on the decline soon. But the hospitals are still very, very busy. They're very limited on ventilators. Some are at 10, 20, 30 times their normal volume of ventilators that are in use. The RT departments were run thin for quite some time, and so was nursing staff. There's a lot of agency nurses here, and from what I can gather at this hospital, it seems to be fairly well staffed at the moment. It's very fluid. It just kind of depends on how many patients there are per day, how many agency helpers that they've brought in for the day. So at the moment, the last couple of days, they seem to be fairly well staffed, and a lot of patients are getting care in the ICU, a lot of makeshift ICUs. They have turned the PACU into an ICU. Most floors now are ICU floors with ventilated patients or patients that have higher oxygen demands. And it's interesting clinical course for these patients. Just like you probably have been reading about, they come in, they're asymptomatic for several days. They come in with a fever, cough, rapidly deteriorate to becoming short of breath, to needing oxygen, which rapidly turns into increased oxygen requirements. They're on face masks, high flow nasal cannulas, being prone, trying to delay intubation and ventilation for as long as possible because the outcomes are very poor. Depending on which article you read and which hospital you're at, it's typically 60 to 80%, sometimes even more, never make it off the ventilator and end up passing away. So we're avoiding intubation and intubating earlier than probably they typically normally would to try and give these patients a better chance at survival. Once they're intubated, then that's usually when the cytokine storm is happening, right around that period. So there's lots of inflammation in the lungs. Then you start to see acute kidney injury, which progresses oftentimes to acute kidney failure and the need for dialysis, and followed by elevated liver enzymes and liver failure, and then cardiac issues, various endocarditis, and a variety of other things that lead to dysrhythmias and ultimately death of the patient in the worst of the cases. So that's sort of the clinical scenario that we're seeing play out over and over again. Here we're in the Bronx, so there's been talk about a disproportionate number of minorities being affected. We're in the Bronx, so we do see a lot of minorities. That could be nature of just being in the Bronx, probably, but we are seeing a large number of African Americans and Hispanics, many with comorbidities, multiple comorbidities, but there's also we are seeing young patients in the ICU, some of which have died in as young as 30s with no comorbidity. So this disease does not discriminate. It does affect people of all ages. What I've noticed, sort of anecdotally, is that there's a lot more men than women in the critical care areas. So that probably is right in line with some of the data that's coming out that show that men have a 2 times greater mortality. If they're in the ICU, their chance, and they're ventilated, their chance of this being fatal for them is quite high. So that makes sense why we're seeing more men, typically older, like I said, with multiple comorbidities. There are some women as well, but definitely a lot more men. And things are very fluid. We're, like I said, part of the Navy community response team. FEMA's here. They're doing 24-hour round-the-clock construction to build several hundred more bed capacity on several floors of the hospital. we are being tasked with opening up a new ICU, and we're going to be running that completely with Navy medical professionals. So it'll be interesting to see how that goes. But this is definitely not some sort of hoax by the media. This appears to be real. I mean, I can only speak to this one hospital that I'm at, but it's very busy. There's a lot of really sick patients. They've flexed tremendously. There are ventilators from FEMA, lots of them, portable ventilators. On any given day, there could be anywhere from 5, well, even less than that, probably 2 or to 3 ventilators, all the way up to 10 sort of available and ready to use. So luckily, this thing is slowing down at just the right time because, I mean, some days there's almost no ventilators left to go around. And obviously having to ration these resources as best as possible. And the situation is turning, thank God. It's not as grim as it was a few weeks ago, but we will see. I will keep you posted on what's going on here. And if you have any questions, feel free to join the Healthcare Entrepreneur Academy Facebook group. And if you're an entrepreneur, you want to make sure that you're preparing your business to be able to run without you, whether you're a military reservist or you're just a regular entrepreneur with no military obligations. Your business should be able to run without you to some degree. It should have different revenue streams that are not completely related to you and what you bring to the business. That's the best piece of advice that I can give you. And I'm going to be doing an episode for the next Tactical Tuesday on how to work remotely with teams. Hopefully you find that helpful. And until then, we will see you in the Facebook group, the Healthcare Entrepreneur Academy Facebook group. If you're not in it, there's hundreds, almost 1,000 now, I think, on healthcare entrepreneurs in that group. So it's a great place to connect, network, ask questions, share business ideas, ask for any piece of advice. I'm in there all the time answering questions. Don't be shy. To find it, you'll go to Facebook, and on the search bar, you'll just type in Healthcare Entrepreneur Academy, look at the groups, and it'll be it's almost always the first group that pops up. We're the only one with that sort of name. And join that group and start to meet each other, ask questions, post your business idea, post your marketing questions. We're in there all the time, and the whole point of that group is to help each other out and network. And so hopefully we will see you in there. And until the next episode, we will catch you in the Facebook group. All right, guys. Talk to you later.
We hope you enjoyed this episode of the Healthcare Entrepreneur Academy. Want to connect with more like-minded healthcare entrepreneurs and professionals? Just head over to jasonduprat.com/group to join our Facebook family for real-time interactions, insight, and resources to get you one step closer to realizing your goal. We look forward to interacting with you, but until then, we'll catch you on the next episode of the Healthcare Entrepreneur Academy.